Hi, Dr. Eric Bunge here with What is Functional Movement Assessment? And of course, as a chiropractic physician, we're concerned about your health, your posture, fixing your causes of pain, and lifelong fitness. So functional movement assessment allows us to look for the causes. Because if we don't look for it, it's going to be very hard to fix it. But we can specifically find things through tests called functional movement assessments. And the interesting thing about functional movement is that we're all the same, even right-handed or left-handed people, whether you're from a different country or lived a long time ago, all humans have the same core inside, and that gets a certain twist as we get older. If you look how models stand when an artist is drawing them, they always start slipping to a right center of gravity. And that's a right orientation to not only the outside and the muscles, but the spine that's inside. And it gets difficult to change that. So we need these tests to help us really understand all the different little intricacies of functional movement and how we're going to correct them. So let's take a look. So functional movement assessment, how we find what the twists are, not only to our muscles and the bones, but also how our neurology controls our movement, how we're going to stand and how we're going to walk. My own personal coursework began in 2007 with Rehab of the Spine, a collaboration of many athletes, but it introduces DNS assessment protocols. And then not only that, but how you see how it's progressing and retest later on. From there, they released a second edition for athletes. Functional movement assessment has the MAG 7 in it. That's if you have pain in a joint and to see how it's affecting your movement. From Eastern Europe, Lewitt's book on the manipulative therapy offers many different ways to assess proper joint function. More recently, we have Gray Cook and his movement, that's functional movement assessment, and then FMA if there's pain, but there's also TPI for golfers. Last couple of years, been looking at fascia assessment. If you make a certain movement, how does fascial restrictions create pain? And last but not least is the PRI books. Of course, I have 6 of these, and PRI is assessing how our body compensates or doesn't compensate when we're in a stance position or when we're walking in a swing position. So just to briefly show you what typically happens because our core gets a right lateralization, and what these tests will reveal is that as we become weight bearing and our core starts getting tighter on the left, it's going to orientate our weight to the right, so we're going to start shifting things, and that's why you'll tend to have a higher arch on the right and lower on the left. It's pushing you over. That's going to create a pelvic orientation to the right, and now our ribs and our thorax are going to have to twist back. So now we have a twist this way, which is going to put a side bend to our cervical spine, jamming up our neck, and we're going to have to compensate with a left lean. So you'll tend to see the left shoulder lower, right shoulder high. It'll seem like the right leg is shorter, and when you walk, it's difficult to get this leg out of stance position, this leg into stance, and then this one to properly swing up. So functional movement assessment is part of performance therapy. We're going to assess, we're going to know what to correct, we're going to strengthen those patterns, and then we're going to create lifelong fitness, helping the person with manual therapy and light energy as we get going. Functional movement assessment is a critical part, if you ask me, of any fitness program. It's pretty simple. We have it down to a few minutes, and then your correctives are just for a few of these patterns, and of course you get to keep the rewards for the rest of your life. With our functional movement assessment and our performance therapy goals, we're going to work on 3 big things. First one, getting us out of this extension. You've all seen like the little ledge that starts forming here as we start. We got to get rid of that extension at the top of our core, and we're going to do that with great breathing exercises. The second one, we're going to get those feet pointed straight. Even though you can compensate and make it look right, there's still a lot of mechanical action happening here in the lumbopelvic region. We need to get that symmetrical. And last but not least, we need to coordinate reciprocal movements up above to keep your shoulders balanced, keep the strain off our neck and our TMJ. So those are the 3 big things: core, pelvis, shoulders, and neck, and they're part of every treatment plan. It's simply wonderful to have those corrected. We look forward to answering your questions. Good luck and have a great day.